We'll probably be a couple more minutes while people join, and then I'll just mute us while we're waiting. Thank you.
I don't want to access my camera. It's just going to bog it down.
Either Firefox or Internet Explorer will down open up either.
I guess we could access it by phone.
What kind of connections do you have on this?
All right, since EMS are crowd here, we're going to give it one more minute. Thanks for bearing with us.
Hello, everyone. Thank you for joining us today. We are going to be talking today about the emergent situation of the 2019 novel coronavirus. I am Gail Broadley, the Medical Director for the Bureau of EMS and Trauma Systems.
Hello, this is Eugene LeVar. I'm the Bureau Chief for Epidemiology and Disease Control and the HEOC Manager for this response through ADHS for COVID-19.
And this is Susan Robinson. I'm the Vaccine Preventable Disease Epidemiology Manager, and I am Operations Chief for this response.
It's dead.
All right, objectives for today, we're going to provide an overview of the 2019 novel coronavirus and national state response. We're going to facilitate a discussion about contact tracing and flattening the transmission curve, provide guidance to dispatch, provide current EMS and answer questions in the Q&A session. Please keep in mind if you are on the phone and not speaking to keep your phone on mute. Thank you. Eugene, I'll hand it over to you.
Thank you, Gail. Well, everyone, just to kind of give you a little background here on what we're dealing with on a global scale, there has been an announcement from the WHO yesterday. They officially named this novel coronavirus, and it is now called COVID-19. So you might hear some interchange terminology between 2019 novel coronavirus and people are used to that new name for this particular virus. So just an FYI on that. So far globally, there are outbreaks that originated in Wuhan, caused by a new type of coronavirus. And there have been cases identified in China with exported cases in a growing number of countries internationally, including the US. Now, just to give you a little bit of a perspective on what we're seeing within China and what we're seeing in other countries, as of today, for a global picture, we have 45,206 total cases with 1,118 reported deaths and 5,123 recovered individuals. Now, out of that 45,206 cases, there's 44,687 in China itself. So that kind of gives you a little perspective of what we're dealing with and how many of those cases are outside of China at this time. So just to go through, coronaviruses are a large family of viruses, some of which cause respiratory illness in people. Signs and symptoms are similar to the common cold or the flu, so it's great to have this come out right now in the midst of the flu season. These symptoms may include runny nose, cough, sore throat, fever, and a general feeling of being unwell. Coronaviruses cause more severe disease in neonates, elderly, and individuals with underlying illnesses, as we know that happens with other respiratory viruses such as flu also. And for more information, there's going to be a link embedded in this slide where you can see CDC's information on coronaviruses. So what is the U.S. at this time? So just to give you a little bit of some action steps that have taken place within the U.S., airport screening was initiated at 3 U.S. receiving a majority of the direct flights from Wuhan, China. Those were JFK, LAX, and San Francisco on January 17th. The first infection of COVID-19 in the U.S. was reported on January 21st in Washington State. And the first case of person-to-person transmission was reported by Illinois on January 30th. On February 2nd, they expanded the airport screening to 11 U.S. airports. And I listed them here for you just to have awareness. And if you notice, Phoenix are not listed as one of those receiving airports. And I think that's an important information and takeaway from today's presentation. So those screenings of those flights are taking place in areas outside of Arizona. So, you here, the states with confirmed COVID-19 cases, they go over 6 states. We have Arizona, California, Illinois, Massachusetts, Washington, and Wisconsin. And so those are the states that have identified cases at this time within the U.S. And to just give you a little bit of a picture of what we're dealing with right now, you might have heard in the media just recently this week they released that they had their 13th case identified. So we have within the U.S. 13
I'm going to be a doctor.
Screened out 347 negative cases, and they have about 60 samples pending testing right now. And that just kind of gives you a little bit of an idea of the scope of what we're dealing with within the U.S. So just to let you know, so clinical data from the U.S., we're still watching and waiting, but a majority have had milder manifestations. So we've had those 13 confirmed cases as of 2/11. Most were admitted to the hospital. There have been no deaths at this time within the U.S. And 2 cases were identified that did not have traveled to Wuhan, but what's important to know is that these were both spouses and very close contacts to those positive cases, the 2 positive. So that's something to kind of keep in perspective when we identify those contacts that did turn positive. So what I'm sure everybody on the phone wants to know is what's happening within Arizona. So the first infection with COVID-19 in Arizona was reported on January 26th in an adult living in Maricopa who was part of the ASU community, which I'm sure you've heard within the media. The county, county with recent travel to Wuhan, China. So the individual had recent travel to Wuhan, China. Sorry for the period in there. Maricopa County Department of Public Health, ADHS, and CDC. What they did is we coordinated to go ahead and initiate a local response. And what was included in that response was a case contact identification. We got that individual who was identified as a PUI and got them classified. And then we arranged testing with CDC. So that kind of gives you a little bit of picture of what's going on within the state of Arizona. And what I also wanted to do is just kind of to put it in perspective. So, we only have 1 confirmed case within Arizona, and let's look at what we're dealing with some other respiratory illnesses such as flu. At this time, in the state of Arizona, we have nearly 17,000 cases of lab confirmed flu. And so those are confirmed cases. And, according to CDC's estimations, what they're saying right now from October 1st to February 1st is that there's an estimation that there has been approximately 22 to 31 million cases in the U.S., and there have been about 210,000 to 370,000 flu hospitalizations and about 12,000 to 30,000 flu deaths. It's just one of those things to kind of keep an idea. What's triggering a lot of the activity right now is that there's knowns and unknowns about this particular coronavirus. There's things that they do know, things that they're finding out, and things that they're investigating at this time. So that's why there's a lot of leaning forward in the activities and the activations that you have probably heard about through the media and through partners. Where with the flu, we do know a lot about how that works and what we're going to expect season to season and some of the prevention measures that are instituted to help control that. So that is probably a reason, and I'm sure it may be in some of your minds, why we have so much activity going on in this particular scenario and situation. So just wanted to let you know about that. And I'll hand it over to Susan to go over the next piece here.
Yeah, great. Thank you, Eugene. So right now, I just wanted to take you through some of the public health measures that are happening, both locally and at the state. So we really have two groups of people that we're doing activities around. So we've got this person's under investigation, and we've got return travelers. So we're going to start with what is a person under investigation? So this is a very public health surveillance word. And essentially what this is essentially a suspect case to public health. And so I put the criteria up here for you guys to be able to see. Really the main pieces we're looking for are some clinical features, which for this one, since it's a coronavirus, are going to be fever and then signs of lower respiratory illness. So cough, shortness of breath, maybe pneumonia, and then an epidemiological risk. And for us, this risk really surrounds either contact with a confirmed case of this COVID-19, so somebody who has been lab confirmed by public health to have this, or someone who has had either recent travel from Hubei province, which is where Wuhan is located, or mainland China. You can see with mainland China, we have a sort of an additional component there. So it's not just anyone who has had any travel to mainland China in the last 14 days, but really someone who is having a more severe illness. So the hospitalization is an important piece to note from that history of travel with mainland China, because we want to be really specific about what these risks look like. It's not just anyone who's traveling to or from China at this point. So when we have this individual person under investigation, what happens? So really the first step for all of this is testing. Testing is really, really important for this particular response. And this current testing can only happen at CDC. So there's lots of ins and outs on how this all works, but we need to get results from CDC when we've got these PUIs. If they're negative, patient is cleared and we don't need to move forward from a public health perspective. This person might have another illness, but we leave that to the medical teams who are taking care of these individuals at that time. If they're positive, this is really where public health gets into gear and really starts working. So immediate isolation of the patient, contact tracing, and identification of healthcare exposures are going to be a really important key piece when we're looking through all of these. These are very time-consuming and take a lot of effort from public health point of view. And so this number of contacts and the recommendations for those contacts and how public health does what they do will really depend on what this contact looks like. And so public health is asking lots of great questions about, where were you? What were you doing? How were you interacting with each other? And remember, at this time, Arizona only has one confirmed case. So while this entire process is very time consuming and takes a lot of effort, we are only talking about one case right now here in Arizona. And I think that's really important to keep in the back of our minds on sort of what our response is looking like. The next group that I want to cover really quickly is these return travelers. It's going to happen. There it is. So we really think of these in two different categories. And I think this is important, as you saw with the PUI definition. Just travel to China isn't what we're talking about. So we've got travel to Hubei province. And so these individuals, anyone coming back from Hubei province, or mainland China really, are funneled through the 11 airports that Eugene showed you earlier. Remember, Sky Harbor and Tucson are not part of them. These individuals who have a history in the last 14 days of travel to Hubei province specifically are going to be quarantined in those states with the 11 airports. So at this time, we do not expect to be receiving travelers coming back from Hubei, who at this point we think are at highest risk for this, this novel corona COVID-19. And so that's one group of individuals. Like I said, in Arizona, we don't expect to see these individuals. The second group are those who have had recent travel to mainland China in the last 14 days. So these are going through the same funneling process. And so at these airports, they're going through a medical screening process. And if we've got individuals who don't have any symptoms, they're going to be allowed to continue on to their final destination. This doesn't necessarily mean that they are a resident of that state, but they have a destination, a final destination they're going to. So here in Arizona, we've definitely received notifications from our federal partners who are doing the screening process. And what public health is going to do is we let our local partners know that we've received a notification. Our local partners are then going to follow up with these individuals, and depending on the risk level that's associated, and that's pretty much public health asking questions and going through and figuring out where they should sit. They're going to follow up with those individuals for 14 days. It could look different. And if there's no symptoms, great. We did our job there. If there are, then we'll sort of go into the next step, and we'll probably move those people into our PUI definition. They'll fit that. We'll move through a series of testing, and that'll get us back to the other end of whether they're positive or negative, and we'll go from there. So those are the two big things that public health are really working on right now, and we wanted to give you some context for what activities were happening here in Arizona.
Thank you, Eugene and Susan. I think that was really an important background to get because the CDC did publish some recommendations on February 6th regarding PSAPS screening and when to do PSAPS screening. And the key part of that recommendation is to really work with your local public health authority to determine whether PSAPS screening was needed. So obviously, based on your jurisdiction, what state you're in, your risk profile is going to be different. And so I think having the context in Arizona to understand that we have one confirmed patient, but we're also not one of the states that's receiving the higher risk patients, is why ADHS has made the recommendation to not do screening at this time for all 911 callers to the PSAPS system. We do have a draft screening procedure in place, so if something changes with Arizona's risk profile, we would be able to deliver that really immediately via the Gov Delivery distribution list. So we do have that prepared in case we do need to activate that, but at this time we are not recommending that. Just a plug for the Gov Delivery. This is one of the reasons we like to get people to sign up. It allows us to distribute important information like this real time if something were to change. So the CDC's recommendation came out over a weekend. We had a lot of activity to determine should we put this out to everyone, and came to the decision that really based on Arizona's risk profile, we weren't going to proceed at that time. That being said, there are still specific recommendations that we wanted to make sure that EMS had a good understanding of. So per the CDC's recommendation for PPE, and this is really specific for patients with possible COVID-19 or the 2019 novel coronavirus, the recommendation is to follow standard contact and airborne precautions, including the use of eye protection. And so this specifically includes disposable gloves, which obviously would be changed if they got damaged or contaminated, a disposable isolation gown, respiratory protection of N95 or higher level, and eye protection. And really keep in mind that the eye protection has to fully cover the eyes and the side of the face to make sure that there's full protection in place there. Some specific patient care recommendations from the CDC guidance for EMS that we thought were useful to include were if you were transporting someone who was suspected or known to have COVID-19 would be that the patient should have a face mask. If they needed supplemental oxygen via nasal cannula, the recommendation is to place the nasal cannula and place a face mask over the nasal cannula. Alternatively, you could also just provide them with an oxygen mask as well. The other key piece is to limit the number of personnel in the patient compartment to essential EMS personnel. So this would be a scenario where you really wanted to limit the number of exposures. There's some very specific verbiage that CDC included regarding aerosol generating procedures. And one of the key things that they really feel is that you want airflow going on within the back of the ambulance if you're doing some type of aerosol generating procedures. So ideally, this would happen prior to leaving the scene. They recommend actually keeping the rear doors of the ambulance open and the HVAC running to help with airflow. If there's a side door, again, that would be another way to help facilitate airflow. So the aerosol generating procedures include bagging of patients, suctioning, endotracheal intubation, SVN treatments, and any non-invasive positive pressure ventilation. So some other specific transport considerations from the CDC. is that drivers, if they provide direct patient care, i.e. moving a patient onto a stretcher, so any direct patient contact should have all the same recommended PPE. The key piece is once they have completed their portion of the patient care, if they're going to get into the front of the ambulance, they would obviously want to remove all their PPE and follow routine hand hygiene. If the transport vehicle does not have an isolated driver's compartment, so for some reason you had an open area that you could not close, then the driver would want to maintain the routine PPE that they had. And obviously the whole vehicle would need to be cleaned after the encounter. All EMS personnel should avoid touching their face while working. And obviously, if you had a patient with known to suspected COVID-19, you'd want to notify the receiving facility so that they could prepare, make sure that they had a room available for isolation purposes for the patient at that facility. The CDC does not recommend that family members be transported in the ambulance. We all recognize, however, especially when we get pediatric patients, that often it's not possible. So ideally, if a parent or family member does insist on coming with you in the ambulance, we should just provide them with a mask as well, because at this point, they've had likely close contact as well with the sick individual. Some additional transport recommendations is to really attempt to isolate the ambulance driver from the patient compartment, keep pass-through doors and windows tightly shut. On arrival at the receiving facility, the EMS clinician should remove and discard PPE and perform routine hand hygiene. And on arrival, after the patient is released to the facility, EMS clinicians should remove and discard PPE in their normal fashion. So some specifics about cleaning. So there's quite a bit of recommendations in the CDC guidelines that we reviewed. One of the things that we noted in that is that there's a lot of terminology regarding types of ventilation system in ambulances, but the key statement that we wanted to focus on is that they really felt that if you get to your destination facility, leaving your ambulance doors open at that time, that airflow alone, with the amount of time it would take you to essentially transfer care, do your documentation, clean the back of the ambulance, would be enough time for sufficient air changes in the back of the ambulance to clean outside of your routine cleaning. So we thought that that was a key piece we wanted to make sure we talked about. When cleaning the vehicle, the EMS personnel should wear a disposable gown and gloves, and any type of eye mask should be worn if they anticipate any type of splashing or sprays from cleaning material. And again, make sure any part of the ambulance that could be contaminated does get cleaned. And obviously ventilation is key anytime using any cleaning products, but also just as part of that decontamination process, it's just making sure that the doors of the ambulance are open to help with that as well. So some additional questions have come up regarding what is approved for cleaning. The best recommendation that we can make at this time is to use the EPA approved agents that list effectiveness in disinfecting against coronaviruses. So that right now is the best recommendation that we can make in regards to cleaning products. Obviously, any area of the ambulance that had patient contact should be cleaned, so stretchers, rails, control panels, floors, walls, work surfaces, and just ensuring that it's a hospital-grade disinfectant that is being used appropriately to clean the patient care areas. Any reusable equipment obviously needs to be clean per manufacturer recommendations. Ideally, if you had disposable equipment that you could use instead of reusable equipment, this would be the best time to use any type of disposable equipment to limit the risk for spread. Attached, we have some resources. So this PowerPoint will become available after this WebEx today. So we wanted to make sure that we had these resources available for hyperlink. We did add to the Bureau of EMS and Trauma System bullhorn. So if you go to the main Bureau webpage, you'll see a hyperlink that will then take you to the ADHS COVID-19 webpage, which has specific EMS resources available. So there's some additional resources. Obviously, the CDC is a great resource for material right now. That is what's really helping guide us here at ADHS with recommendations to all different partners in the Arizona community. And there are some different health alerts that you can sign up for. So there's the Arizona Health Alert that you can sign up for, register, and that is on the website listed below. And then also IDAZ, which is another way to get other health alerts as well. This is an app on your phone, so you would get phone alerts with this version. If you have any questions regarding this presentation, please feel free to contact me. Again, this is gail.bradley@azdhs.gov. And if you have any clinical or person under investigation related questions, that should go to your local public health department, so essentially your county health department. And at this time, we will open up to any questions on the phone. So everyone is on mute right now, so you can type in questions if you want, and Shelley is going to also start unmuting people in case people have questions.
Star 6.
I mean, I've heard the more Chinese playing around with biological weapons.
Are there any questions for us?
Yeah, I've heard.
I see some questions coming up there at the. Please remember, if you're not asking a question, to keep your phone on mute. And we see some questions under the question tab.
What about reusing PPE in light of this DNA contact?
I think.
There is some information on the CDC website that we can definitely include with the presentation that does go over appropriate and extended use of PPE such as N95 masks, and also gives guidance if you have any expired mask and what the recommendation is from the CDC on that. And we can definitely make resources available so you can have that information and be able to make a determination per your policies and protocols.
Oh, I'm muted. No.
I don't understand what you're saying. Okay.
It's Jeff Fountain from Phoenix PD. I have a quick question.
Sorry, Jeff Valentine?
Yeah, from Phoenix PD. So a lot of my officers have been asking, especially the ones that work at the airport, because they're seeing the CDC recommendations about the N95 mask and the goggles. And in a large open space like that, is there anything different that they really need to be doing other than just universal precautions right now?
I think in your day-to-day, there's probably not going to be a huge change. I think, this is obviously tricky because we have to know that we're handling a potential COVID-19 case, right, for these recommendations to kind of come into play, which we know is sort of a little bit of a catch-22 in a lot of situations. So I don't know that this recommendation really changes anything from your normal day-to-day. But would really just be implemented if we knew what we were dealing with was a suspect or confirmed even COVID-19 case.
Okay, very good. Thank you so much.
And that, again, ties back into our risk profile in Arizona, knowing that we have the one patient, but also recognizing we're not one of the 11 airports that are potentially getting some of these patients. And all the patients from the high-risk areas are getting funneled to areas where they're getting screened and quarantined as indicated.
All right. Excellent. Okay, thank you so much.
Thank you, Jeff.
Aaron Kessler was asking on contact isolation currently they dispose of PPE.
I think if that's your normal procedure, that's great. I think that there was some conversation around extended use, and I think extended rather than reuse is preferred from the CDC's perspective. If we get into a situation where we may have shortages, and that's just, I think, a preparedness mindset of what would it look like if, not to say that that's where we currently stand. So if your current procedure is to single use for PPE, I would say continue down what your normal procedures are at this time.
Laura Sink asks, what level of fever do these patients usually present with?
That's a great question. I think, the guidance we have is subjective fever. It's a little bit tricky with a sample size of 13 to say a whole lot about the U.S. I think we've seen quite the range of presentation of illness. Eugene, I don't know if you have anything specific you think.
Sure. I would kind of go back to our information that we said, a lot of what we're seeing within the U.S. it's mild symptoms that are coming through. So, that's what we're looking at is maybe a fever of 100.4 or so, or as Susan mentioned, subjective reporting of fever is what we're seeing right now within the U.S. Now, whether or not that picture will change as we see an increase in the cases, and that will kind of change our data. But I think we can kind of speak to what this point has been in that range.
There are 2 questions related to N95 surgical masks. So there are 2 questions related to N95 and surgical masks supply. When and who activates the use of MMRS stocks?
Sure. I think that goes back to kind of the preparedness piece that Susan was mentioning. One thing we would definitely recommend is having, as Gail mentioned, collaborating with your local health department, and then also having those conversations, looking at your own internal stocks to see whether or not there's a true need for PPE, and then communicating that to your local health department, because what will happen is that'll go up the chain up towards the state HEOC, the Health Emergency Operations Center, where we can help make a determination, what do we need to do to fulfill the needs at this time. And that goes into that decision-making process, is knowing and having an awareness of where our EMS and other healthcare partners stand with their supply, so that that decision can be made.
Can you share if PSAPS, the 911 call centers, are being notified by county public health if a patient lives at an address? So I think it's for PIs or suspect cases.
I think that we know like 2 of our larger counties definitely have confirmed with us that this is a practice that they are currently doing with their PSAPs. I'm not 100% sure with all of the other counties and jurisdictions, but it's something that we've mentioned to our partners on the public health side as something to consider as a possibility. So I don't know if, Eugene, you have anything else?
I would add to that, with the public health contacting these individuals, whether they're those funneled returning travelers that just had traveled to mainland China or others, they are communicating to them that if they are in need of medical transport or medical care, to be sure to contact public health so they can help coordinate that effort, so that they can go ahead and reach out and coordinate with other partners that may be involved with their transport. First line, and what we're seeing a lot of right now, is the use of private vehicles to seek health care. But there may be a scenario and situation where medical transport is needed. And I think where that goes back to Gail's point of speaking with your local health department, maybe expressing that that's some information that you would like to have at that time if it's not being shared, and so that some protocols can be set in place.
Any other questions?
Answer the N95 single-use question.
PSAPS, public safety answering point is PSAP. It's a 911 call center.
Any other questions? All right, thank you everyone for participating today.